Hi, I hope you're doing great. In this session, I would like to cover up a topic of lip shading effect, full coverage. When we're talking about full coverage, we're referring to lipstick effect. So in this case, as you can see, I have some dark spots. This technique is perfect for those people that they would like to have a full coverage effect, or they need some correction of, for example, hyperpigmentation, or they have birthmarks on their lips. Their lips are in a darker tone and they would like to have pink color, so you're going to work with full lipstick effect. The soft shading does not help you at all. In this case, it's just a waste of time and energy, and the coverage is very, very low. So when it comes to this case, you have to make sure you're going with super full coverage effect. When a case like this is coming to you, they already have some pigmentation on their lips. What you want to do is to cover it completely to a different color, right? Have the same mind. If there's anything like birthmark, the birthmark does not cover. You can make it a little bit lighter, but you cannot fully cover it. But the dark spots, or the hyperpigmentation area around the lips, is coverable, and you can totally cover it with the gold color. We do need some color correction that I will teach you later on in the theory, but for the practical, we're going to go with 3RL needle and very slow movement on your hand, and the speed machine should be in 6.5 or sometimes 7. It depends on the bleeding. I'm just gonna go with 6.5 for now. So our hand movement, if you remember in soft shading, it's a little bit like in bigger strokes. In this one, we're going with very soft and short strokes. Just gonna adjust this. You should go very slow in one direction, and then you will change the direction in the second pass. So in this technique, the bigger the needle is, the quicker you can finish, and the more color saturation you will have. You can go with 3, you can go with 5, you can even go with 9 Magnum, but you have to be very careful not to torture the client. So I'm gonna go ahead and make a full coverage in the upper lip, and then I will wipe it and I will show you how it looks like after one pass. Okay, so this is after my first pass. As you can see, the border is almost darker. There's no more shade or fade, in this area. So I'm gonna go ahead having my second pass, and in this pass I'm going to go in a different direction. You don't need to press anything. You just make sure that your hand movement is steady. So I'm gonna go ahead and finish the whole upper lip. This will be my third pass. I'm going in a 45-degree angle and get into all the little spots that are kind of like didn't hold the pigment. As you notice, my strokes, my movements are very short and small because we are looking for a full saturation. There's nothing powdery or soft anymore. This is lipstick effect. We want to cover every little pixelation. So here it is, the final result of the upper full lip shading blush or full shading. As you can see, everything is covered except the little birthmark. In real life, it's the same. You cannot cover the birthmark. Your practice should be something like this. You can either pick the lower lip or the upper lip and do a full shading on one side and the soft shading on the other, and send me a picture. If you have any question, comment it in the comment section below, and I'm waiting for your next practice. Thank you so much, and we'll talk soon.